I'm sharing my screen. Okay, fabulous. Um, you can do whatever you want in the background, Ashley, and everyone. So I bring to you this presentation on CP, or cerebral palsy, that I've kind of adapted it to be a little bit maybe more specific to VR and our world here. So what I was thinking we could do before I launch in, and if you want to turn your video off, you can, is to just take a moment and just think about cerebral palsy as a disability, and to think in your mind of anybody that you know personally who has it, or maybe characters that you have seen in a film or a movie who have CP, and to just kind of contemplate, when you think of this person, like, what are they doing for work? Where do they live? What is their mobility like? How do they get around? What does their social support look like? Family support? Just kind of create a little picture in your head just for a moment. And hold on to that. And then we'll launch in. So I do have cerebral palsy, so I could be a person that you think of. And so throughout the presentation, I will talk about cerebral palsy as a disability and kind of the various manifestations. And then I'll use my own story as a piece of it. So I am featured here in this lovely slide. And will be throughout. So what is cerebral palsy? Cerebral palsy is classified as a developmental disability. It is caused by abnormal brain development or damage to the developing brain. And this damage affects a person's ability to control their muscles. So if we break down the etiology, cerebral is having to do with the brain. Palsy is weakness or problems with using muscles. And I didn't say it at the beginning in terms of structure for my little workshop presentation today, but I have some kind of information that I can present here, and then we'll transition into a little activity, and then I have time at the end for questions. So a little more about what cerebral palsy is. It's the most common motor disability of childhood. We use childhood because that's kind of when it's diagnosed. That's when it's really noticed. Some individuals have minor manifestations that are barely detectable. That would probably be me. While other people have significant functional manifestations and might have to use adaptive equipment to move around, like the picture of this child. The type and manifestation depends on the location and extent of injury to the brain. I did like the statistic that over half of children with CP can walk independently. I think that maybe a lot of times when we think about cerebral palsy, the first image that comes to mind can be one of someone who is greatly affected, so perhaps in a wheelchair, maybe doesn't necessarily have control over movements of their head and neck. But over half can actually walk independently. And the specific cause of cerebral palsy in most children is actually unknown, because it is damage to the brain that happens so early on or even before birth. Sometimes it can't be exactly pinpointed. So in many cases, like I said, it's unknown, but there are some potential cases that you can kind of deduce, do a little detective work. My CP is thought to be the result of me separating from the uterine wall during my mom's first trimester of pregnancy. So my cerebral palsy would be considered congenital. That means that it was happened before or during birth. There's a small percentage of CP that is caused by damage to the brain after birth. So this would be something like acquired cerebral palsy is the result of infection like meningitis or injury to the head, which could be quite sad as to why that might be acquired. So these are just some stats. Most cerebral palsy is thought to be congenital. And then these are some risk factors. All of these things, they don't necessarily mean that you will have CP if you have a birth complication or a low birth weight, but they're just kind of parts of the puzzle when we're diagnosing. So, in terms of early signs and diagnosis, I mentioned that it shows up in childhood. So, manifestations of CP might not be noticed right away, but often parents will observe that their child has delayed development and they're not meeting milestones when they're expected to be. There's not a definitive test to confirm or rule out CP. A child's physician might recommend that they see a specialist, and the specialist will look at health history, evaluation of reflexes, muscle tone, and posture. They do a full neurological examination and ultimately rule out other causes for the developmental delay. My mom brought me to the doctor when I was 13 months old. Before that time, my parents were kind of aware of a few things with me. I was born with crossed eyes and I had corrective surgery when I was 6 months old, which now we know is often linked to CP, but at the time they didn't really think much about it. Um, but my mom does say that when I was little, my movements were kind of like Katharine Hepburn's. Like I had jerky head movements. I had difficulty sitting up on my own. I had to be propped up on a pillow. Um, I wouldn't catch myself when I fell over. A lot of times they talk about CP, like kids having floppy heads, so that sort of floppy body. And then at 1 year, I was trying to walk, but love my mother. She says that my legs looked like a baby goat. Um, and so she became quite upset. So at 13 months, when she realized I was looking kind of like a baby goat and I wasn't reaching milestones, she brought me to the doctor. And then they sent me to the child development clinic in Burlington. And through testing, observation, and looking at the history of my mom's pregnancy, I was diagnosed with mild ataxic cerebral palsy. And I ultimately took my first steps when I was 1.5 years old. But in this slide, I just wanted to show kind of just the way I'm leaning on that sled or the way I'm tucked into that chair might be some of the examples of how I really required that support to sit up. And in my adult life, sitting is perhaps the most fatiguing thing. I think that to compensate, I've become very, very, very strong in my spine and core. So I sit like I have perfect posture, but I'm using a ton of muscles to do that. And it's just incredibly fatiguing. So,
Meredith,
oops, yeah.
I'm sorry. If we
No.
have questions, do you want me to just like interrupt you or do you want me to put them in the chat
Oh,
box?
I'm so glad you asked. You could interrupt me. You could save it for the end. But
Okay.
the chat I am finding is a little difficult for me to see while I'm sharing my screen. So
Okay.
I would interrupt or hold the thought, but you can
Which would you
totally.
prefer?
You can interrupt me.
Okay, well, I'm curious
We can make
if
it a conversation.
like you talked about the cerebral palsy mostly happening like before birth or during birth. So I feel like with a lot of these like other diagnoses and things like that people I guess I'm wondering, is there any sort of test that they've come up with for when you are pregnant to know if
Right.
that's going to happen? Like, I guess I'm
Right.
thinking, like,
Right. That like so my mom was aware at 7 months that there was a
okay,
trauma when I separated. So like if I'm interpreting this correctly, when that happened to my mom, would there be a test that she could have to say, okay, this happened to my baby. Will my baby have CP?
yes,
And as
yes,
far as I know, there is no test that could
okay,
do that,
thank you.
unfortunately. Unless I speak out of turn. But as far as I know, that's not an option right now.
Thing, yeah,
But
thank you.
good question. Thanks, Ashley. Um, so I just wanted to show a little bit more. I think on the left, I believe this is perhaps what my mom interprets as baby goat legs here. Um, and then on the right, just kind of this example of how to do one task, like I'm sprinkling to decorate that cookie with one hand. And then because it takes so much concentration, the other hand is held up in this kind of grasp. And that behavior has been something that I've worked to change so it doesn't show up, but it will periodically show up when I'm cooking now in my adult life at the kitchen, at the stove. Sometimes I notice that one hand goes up. And so my mom is like, put your hand on the counter. Or when I would be sitting and eating at the counter, they used to have a handprint for me when I was a kid. So I would put my hand on the handprint on the table so that my other hand could be eating. And so I wouldn't do that, what they call maladaptive behavior, which there's probably a whole psychology around that, but we won't go into that right now. And then this is me kind of starting to take my first steps, and starting to stand on my own. And I also just wanted to throw my mom in here because I think she like deserves a whole bunch of credit for the early intervention. I know other folks that did not get diagnosis as early as 13 months. It was much later in life. So because she was paying such good attention, she took me right to the doctor. And then she really helped with all my physical and occupational therapy. So like big shout out to my mama.
Mm.
Um, and then this is me walking. So probably not the way that most kiddos start to walk. It looks like I'm trying to ride a skateboard, but you'll just see like my balance, my weight distribution. Like I'm just not quite aware. And then I have super straight legs here. And this is something throughout my whole life. If I ski, if I skate, if I'm working out, if I'm doing yoga, people are always like, bend your knees. And I genuinely believe that I'm bending my knees because to me it feels like I am, but it looks perhaps like that. So that's just sort of one of the manifestations for my cerebral palsy. But there are 3 different types of CP. So the type and manifestation of CP depends on the part of the brain that was affected. Um, and I don't know if, am I blocking can you see yourselves on my shared screen? I don't want to block the slide, but so spastic cerebral palsy is the most common. And this is kind of stiff muscles. Dyskinetic would be uncontrollable movements. And then ataxic, which is the kind of CP I have, is poor balance and coordination. So for me, my cerebellum was the part of my brain that was damaged. And the cerebellum, well, we presume, but the cerebellum is actually developing at 7 weeks, which is the same time that I had my kind of detachment from the uterine wall, my problem. So that's part of the kind of diagnosis is they said, okay, this was happening at 7 weeks. This is how it's manifesting. It would make sense that it would be from the cerebellum. So I'm going to go into each of the different types kind of briefly. Spastic CP, as I said, is the most common. About 80% of people with CP have spastic cerebral palsy. And there are kind of 3 different types of it, and the graphic on the right displays sort of how those might manifest. So spastic hemiplegia would be one side of a person's body being affected. One of my good friends' moms has this type of CP. So her leg, she has a limp, and her hand, she has no dexterity in it, and it's kind of always clenched in a little bit of a fist. Spastic diplegia would be muscle stiffness maybe in the legs. So we're kind of looking at the bottom half of the body. And then spastic quadriplegia would be the most severe form. This is all 4 limbs, the trunk and the face. This is probably the CP where speech is difficult, swallowing might be difficult, holding up one's head. You have to have a wheelchair with the back of the head support. So that's spastic. The next form is dyskinetic. And this I regret to say that I did the least amount of research on. So if I were to dive deeper into this, I would like to learn more about dyskinetic cerebral palsy. But this is the one that would manifest with slow and uncontrollable writhing or jerking movements of the hands, feet, arms, or legs. And then because I'm giving this presentation, we're going to focus more on ataxic. So if this affects balance and depth perception, a person might be a little unsteady when walking, have difficulty with quick movements or movements that need a lot of control, like writing, have a hard time controlling hands or arms when reaching for something. So again, here I'm standing and you can see my little hand is trying to balance to keep that control so that I can feel steady. And I just think about a couple things to call out for real life examples in terms of myself would be like the depth perception piece. I have always had a really hard time climbing fire towers. I am not at all afraid of heights, but climbing the stairs on a fire tower feels almost impossible. And I think that's because of my CP in terms of the balance and depth perception. With the quick movements, like in theater, we do this game called Zip Zap Zop, where you have to like do this hand gesture across a circle of people and you go to one person, you go to the next, you go to the next, and you have to move your head really quickly. And I often feel like I'm about to pass out when I do something like that. And then writing is tiring. Playing frisbee is really difficult, catching the frisbee. So kind of reaching for something, grabbing for something. And as a kid, it was more obvious. Like if I would go to do one action, that the other hand would be in the fist, but that has
Meredith,
changed. Yeah.
um, do you find that like extra stressors or being fatigued kind of exacerbates the problem, or is it kind of like consistent throughout the day? Or
It does. You're a genius, Ashley. Um, so yes. So if I'm sick, that is the worst. So if I have something in my, like I'm physically ill, um, that's when it shows up the worst. So a good example is when I'm sick or when I'm really tired, my hands shake. So if I go to drink a glass of water, my hand will shake. Or a lot of times, like if I go hiking, like people like to hike and then they have a beer after, right? So
Mhm,
if I go for a hike and I go to the bar and I have the beer, I go to pick up the glass and my hand shakes like crazy. So I have to stabilize my elbow on the table or sometimes use a different arm to see if one is less
mhm,
tired than the other. Uh, but yeah, that's absolutely a factor.
thank you.
Yeah. So in terms of manifestation of CP, as I mentioned, it's different for everyone. Um, we can look at kind of certain areas. So this graphic focuses on gross motor function. So this kind of ranges from children being able to kind of walk at home, not having to use railings when they're on a stairs, performing gross motor skills such as running, jumping, but the speed, balance, and coordination might be limited. I think perhaps when I was a kid, I must have fallen probably a little bit between maybe levels 1 and 2. Um, because I do feel like I would have to use and still do a railing for balance, but I have not ever experienced difficulty walking long distances. But the balancing on uneven terrain does seem a little familiar, like from hiking or trail work that I've done. Um, they might need some physical assistance at that level to for mobility, like a handheld mobility device, but not as much as kind of in the level 3 to 5 over here, where you might use a cane or kind of a um, like a walking frame or a wheelchair for long distance travel. I followed a blog of a girl. She used a walking frame most of the time, but if she had to do long distances, she would use a wheelchair that she could power herself. And then at level 5, you have a wheelchair that maybe has to be um, moved by someone else or electronically powered because movement is so much impaired. And then in terms of, so that's kind of the gross motor skills, but then for me, I talk a lot about my difficulty with fine motor skills. So things like handling objects, um, the dexterity in the hands, and this is a sort of boring slide. I don't need to go over all of the wording, but it's just to say that there's a range of manifestation that like somebody might be able to handle objects easily, and then someone at level 5 does not handle objects at all um, and might have to use different ways to communicate, be it through writing and speech, maybe using computer and assistive technology. When I was in my physical therapy and occupational therapy as a kid, there were a lot of things we did with like a big tray full of beans, um, like not cooked beans, so that I could learn how to put my hand in there, pick one up, and just grab the one individual thing to practice that fine motor skill. And then communication is another manifestation. So for me, like speech is not affected at all by my CP, but there are absolutely people with CP who have limited speech or don't speak in the way that perhaps we would expect someone to. And then in terms of like written communication, that could definitely be affected as well. And then other manifestations. So as we discussed earlier, CP is characterized by irregularities of movement, including alterations in muscle tone, muscle control, and posture. But depending on the part of the brain that's affected, you might have additional manifestations of CP because it is essentially brain damage, if you want to use that word. So things like alteration of vision, that if I have that experience, hearing, communication, seizures, intellectual ability, learning difficulties, behavior difficulties, being able to control bowel and bladder. So just kind of depending on what part of the brain and how severe the manifestation, you might see some of these things. It's not guaranteed. And then I do have a slide on fatigue because I've, especially recently, just really been experiencing a lot of fatigue and noticing that. And I don't have a source good enough to quote, but I have heard it several times that individuals with CP burn 3 to 5 times more energy than someone without. So this is like to do any task for me, my brain has to tell my body what to do. And then my body has to figure out how to do it with control and coordination. And that is tiring. So even just sitting in a chair is very tiring. Um, I am a pretty active person, but I will fatigue quicker, maybe than someone without CP. And like I mentioned before, if I'm already dealing with stresses, anxiety, or illness, I think that makes my body more tired than most. And it can be very challenging because I will forget I have CP and just think, what is wrong with me? Why am I always so tired? So doing this presentation was really important for me to understand more about, not to like give myself an excuse, but to be more compassionate and to say like that there is perhaps more going on, that and it helps me to have compassion for my consumers and understanding in terms of how fatiguing certain conditions and disabilities can really be.
Meredith,
Yeah.
I'm sorry.
No, I love
Um,
it.
when you were just talking about like the therapy that your mom like would have you go to and working on those fine motor skills, I'm just trying to think about our consumers that maybe didn't have those things growing up, and I'm wondering if things like that with the adult population, are they beneficial in the adult world? Is that something that can kind of be helpful or recorrected, or do those things really have to happen when you're younger?
Uh, Oh, I love it. So I think yes, it is beneficial. I know that when doing it when young can have a huge impact on minimizing some of these like just behaviors that you get used to doing so that it doesn't show up later in life. And my
Mhm.
friend's mom, who I interviewed with CP, she didn't have a lot of intervention early. She was given some exercises to do, but she didn't want them.
Mhm.
So I wonder, in a way, like, would her limp perhaps be something that might not be as noticeable now if she had done it early on? I do know for myself, and I can't speak like an expert, but I can speak for myself that yoga has been so helpful for me to understand how my body feels and moves in space and how it is aligned and where it is strong and where it is weak. And so I would say that for adults with CP, doing physical therapy, yoga, um, mindful physical exercises could absolutely make a difference and give you more of this knowledge. Like, I'm always getting sore in my hip, and it's like, oh, well, maybe it's because I'm overcompensating with different muscles, because see how strong these ones are, and what can we change? So I do think it would be beneficial. And I have known at least one other adult with CP to have been recommended to do yoga from her physical therapist. So
Thank you.
yeah, it's fabulous. Um, so cerebral palsy is a lifelong condition. So like I will always have it technically, but it's not progressive or degenerative. So for me, I don't really expect, and from what I've read, that it will get worse over time. I maybe like as I get older, if perhaps muscles are less strong, I might be more tired, but it's not for me going to get worse. However, it can, in certain cases, lead to secondary complications. So contractures, shortening of muscles, scoliosis might develop, dental problems if it's difficult to brush your teeth, osteoporosis, respiratory infections. And the best prevention or the best management would be prevention for those things. So examples of prevention would be exercise, posture control for scoliosis, learning techniques for brushing your teeth, diet, so like a diet rich in calcium, learning coughing techniques and improving breathing patterns and lung expansion to prevent respiratory infections and distress, such as COVID-19. No, you can't really prevent that. Um, so I'll talk more specifically about kind of management in terms of my CP. So I did receive physical and occupational therapy as a little kiddo. It was paid for by the state of Vermont. So the clinic I went to up in Burlington was through the state. The state paid for my physical and occupational therapist, and I went to 2 years of preschool, and the state also helped to support to pay for that. Um, so it's a good thing I get to give back by working for the state. I got this little red cart that's in the photo on the right to push around, to walk and push. My mom would create these little obstacle courses in the yard so I could practice certain movements. My parents had me very active. We would do like in the classroom, it was very integrated, my occupational therapy. So the woman would be in our class and she would have everyone in the class in preschool doing like a movement exercise. So everybody was doing the same one, but she was doing it so she could watch me. Or we all had a tray full of beans and we would sort through the beans together or make a necklace out of Fruit Loops or whatever it might have been, but it was for me. I didn't know this. I had to interview my mother to learn all of this because I don't remember things from when I was in my early years of preschool. They also would, like, they took me to the playground before I went to school so I could kind of practice moving around on the playground equipment. I had an IEP through grade school, and then I think in high school I was just down to a 504 plan. I don't really recall a lot of intervention around that. I think it was kind of up to me to ask for things. Um, and I've got a couple more pictures, just like, yeah, playing with shaving cream, like all of that sort of tactile dexterity. There was this ladder that my mom would color the rungs of, and she would have a little song that was like, over red one, over blue. And it's like one of the things I do remember. I was skiing like really, really young. I think I was probably 2, and it was through an adaptive program at Stowe. And skiing was just great. Like the ski boots were really great. They force you to bend your knees. So I've been skiing and snowboarding my life. I was also ice skating, and I did in high school, I did conservation crews. I was involved in gymnastics. I've always loved to go for long walks. I have a younger brother who's very active. And so when Sam was learning how to ride a bike, I was like, well, I have to learn at the same time he is because I'm older than him. So I was very determined, and I did. um, but so, yeah, just swimming, trampoline, kind of a lot of physical activity for strength. And additional management of CP, sort of in cases perhaps beyond mine, would be this long list of items. I do still wear orthotics in my shoes. I have flat feet, and so I do have those. When I was a kid, they were more extreme, like a little bit more of the kind of splint situation, so they would go up to my ankles. I don't remember this, but I've been told. And then in certain cases, you can have corrective surgery for joint irregularities to release tight muscles. Medication has been used in certain manifestations of cerebral palsy. People talk about a lot of pain with CP if you have a great manifestation. And so medication can sometimes be helpful for the pain, along with all of the other things like physical therapy and et cetera, et cetera. But we don't need to talk about a long list of things that are kind of boring to look at. Instead, we talk about me. So in terms of the functional aspects, so the way that CP manifests itself in my kind of day-to-day, I think the biggest challenge is that it's a hidden condition for me. Like everyone says, oh, I would never know. which means that even I forget and have forgotten about it a lot. And but it does manifest, it does crop up in certain areas. When I was in middle school, I was putting my hair in a ponytail one day, and my friend Tanya was like, "Why do your hands shake when you put up your hair?" Um, but I was just mortified at the time. Now I would be like, "Oh, I have cerebral palsy." But it does show up in certain areas. So putting up my hair, I mentioned drinking water. I've done a lot of trail work. Like I was on youth conservation crews when I was in high school, and then I led youth conservation crews in college, and crossing streams, like having to kind of balance on rocks, or if it's like, God forbid, one board across the stream I have to balance on. It's the pits. And I get all flustered. And what would happen is I wouldn't tell anyone about my CP. And then I'd have to cross a stream. And then I would be like emotional and stressed because I had to talk about it. Um, but as I got older, I started to work on adult conservation crews instead of youth. And I noticed it became really obvious because the pace of everything is like greater. So you work with a bunch of 20 somethings that are hiking in Montana, and I was the slowest hiker always, and carrying tools. Like I was trying to carry a pack and a crosscut saw, and I was weebling and wobbling all over the trail. I was tired, I was uncoordinated, I didn't feel solid. And that was when I really noticed that, I mean, I think of myself as a pretty fit person, but compared to these like really fit 20-year-olds, I was the slowest and I had the most difficulty. So it does crop up here and there. When I get sick, it's worse. Um, Activities like threading a needle, putting on eyeliner, plucking my eyebrows, doing anything crafty are really like the worst because of that fine motor concentration. And I notice that like when I go to do it, my whole body is tense. So if I go to thread a needle, it takes my entire being to do that. Like it is very, very fatiguing. And sometimes even like my head feels like it's like working overtime, because it probably is. Um, I do get tired writing, but like I said, I was on a 504 plan in high school, and I was supposed to, or I was able to get extra time on tests, and written exams if I needed it. But I think like a stigma thing, maybe pride, I never wanted to ask for that. I do remember asking for support in biology though with microscopes, because putting that slide on the microscope was a really difficult thing. So I do remember talking to my biology teacher, and he just had my partner do it for me, and they were fine. They didn't care to do it for me. Um, Playing frisbee, I mentioned, and then I just wanted to talk a little bit about the snowboarding, because, and I think maybe in VR we could have some respect around this, but just sort of having like that compassion and realizing how, like in terms of motivational interviewing, like I had to sort of do it to myself to say like, holy shit, you did these things. And when I lived in Montana, we would like hike up the mountain before the chair was running. And so the first season that we did it, I hiked up and I didn't wear snowshoes, and I post-holed the whole way up. And when I got to the top, I was so tired and there was so much powder snow, I couldn't snowboard down. So I sat on my butt and I just like cried the whole way down, and it was very sad. And then in general, so when I would be snowboarding, there would come a point in the day where I would just be really tired and hungry, and I just like I couldn't get up if I'd fallen down. It took me so much strength to like push myself back up, and I would just like beat myself up and get down on myself. So we talk a lot in my class about kind of maybe how things might relate. Like you might have a physical connect kind of condition, and there might be like the sort of mental health aspect. So I believe this was really happening for me at that time, and not kind of recognizing like when I needed a break, and just knowing that maybe I just could take a little break. So if we think about like our work in terms of the job, so put someone in a job, they do such and such and such, and then knowing that at this time you just have to take a break, eat some food, and then you can have the strength to go back, instead of bringing yourself to the point where you break and then beat yourself up and think you can't do it and kind of get into that cycle. So that was really like a learning moment for me. Um, and so what I wanted to do next was to do a discussion, and I can't do breakout rooms, but we have a small enough group that I don't think it matters. So I thought that it would be neat if we could challenge ourselves to think about cerebral palsy in terms of vocational rehabilitation. And you could consider the person that you thought of at the beginning, or anyone else. You could think of me, you could think of a hypothetical, and I'll just open up a discussion question. So if that person was a voc rehab consumer, what factors regarding their health condition might be relevant when exploring career options?
Meredith, this is Neil.
Yeah.
And as I had said before, I had a foster son who lived with me for 6 years, and he had CP. One of the things that I really found listening to you talk, we talked an awful lot about the physical part of it, but it seemed like, at least with him, he was walking with those specialized crutches to start with, probably 50% of the time on the crutches. Second half, he was in a wheelchair during the day. He's now in a wheelchair completely, but a lot of times emotionally, I
Mm.
think his frustration. Did you find that with yourself, or do you see that sometimes you want to do more, but you just have a hard time getting to that point?
I think that I think that's exactly it. And I also like, because it's maybe so invisible for me, I hold myself to the same standard as someone who doesn't have CP. Or when I was in Montana, as my boyfriend at the time and his level of physical fitness. So if he was skiing and I was snowboarding, I wanted to do what he could do. I wanted to have that ability. And maybe part of it is that I didn't work out as much or whatever, but I think there's that, yeah, the barrier. And I also would like to, like, I talk a little bit with some folks around like how our wellness activities can sometimes be crafty. And I'm a creative person. I like that. It's not that I hate crafts, but I have a really hard time doing it. Like, it's just so tiring. And so that's an area where I wish I could just do it with ease. Yeah. Thanks, Neil.
This is really helpful, Meredith.
Oh, I'm so
Very
glad.
helpful.
I was talking and I was muted. I was thinking as an employment consultant that like I would want to take into consideration both the mental and physical conditions that you have to deal with every day, and exploring those options, we just have to be very mindful. And I would think that I would want my consumer to be connected in with AT right away.
Mm,
Just because thinking of, you were my example because you're really the only person that I definitely know. Like I could think of some of my consumers that might, but um, in you saying that it's more of like a hidden thing for you, but then you explaining all of these obstacles that you have to face, like just sitting. So how is my consumer going to sit in an office job? How can we get them connected with AT so that they're going to be successful? Or just those little things. I would want them to be connected to an AT specialist right away if they, didn't have a strong work history and weren't so aware, because I feel like you're very aware and in tune with the things that your like cerebral palsy does for you. Um, so I think that knowing how much this person knows about their diagnosis as well.
Mm.
I don't know that I like answered that question, but those are just
yeah,
things that
no, AT is totally something to consider. And I know one of my first consumers when I started this job she has RA. And so we were just having a conversation with her around the amount of things that she does that she's struggling to do, and how you don't have to struggle to do them. There are things that can help you. And when I was talking to her, it was like I was learning that too. And I thought, oh gosh, what kind of AT could be useful for me. And then there's like stubbornness. Like I know there are things I could do to help with writing, but I really like the act of physically writing on paper. So I'm just going to keep doing that.
Mhm.
Yeah. Thanks, Ashley.
Meredith, one thing that I like to ask folks,
Sorry.
Is that I like to ask people, like, how does this impact your everyday? If symptoms or manifestations are sort of at their worst, how does that affect your day? And sometimes that gives me the worst case scenario that we can talk through. So for somebody that's sharing that they have CP, but I don't know that just from sitting across the table from them, that's just the first start of that conversation, is to really say, okay, well, tell me, when you start your day, how is it when you wake up? You know, even things like what you said about putting your hair up or getting dressed, or how is it preparing your breakfast, and those everyday things. If people start with any sort of disability, but especially one that's invisible, and I can't, just by sitting with somebody for an hour, I can't see that or understand it. Sometimes if I ask people, what does it feel like when it's really, really bad? That sometimes helps me get a good understanding, so then we can carry it over into the workplace.
Yeah. No, that's awesome, Liz. And I was following a blog of a woman who has CP, more extreme manifestation than mine. And she would write in her blog, she would call them bad CP days. And so she would like do video posts, and she'd say like exactly what you're saying. I woke up this morning in so much pain, or today I can only walk such and such many feet. Yesterday I could walk this many. And so like really hearing from her on that blog how different those days were made me reflect for myself, like what would my bad CP day look like? Do I have such an animal? So yeah, such a good question to ask.
Sometimes I've noticed too, Meredith, is that it's not always a whole day.
That's what it is. Yeah.
Just be that folks are feeling a certain way, and like what you were sharing about giving yourself permission to take breaks. I think some people that we work with right now, obviously, I mean, even I can think of somebody that Ashley and Linda met with last week or the week before, and she was totally upfront with us by saying, I can't do anything until after 12.
Yeah.
And so she's not kind of saying, okay, my whole day is shot, but she's pretty upfront by saying, I really can't get my body moving, and I can't do anything physical, concentrate on anything until after about 12 o'clock every day. So I was like, okay, well, that's good to know.
Yes.
Yeah.
No,
So sometimes it's not the whole day.
I have to say, like, I shut down after 9 p.m. because and I just really do. Like, that's for me. I am not functional in the evening as well as I am during the day, because I need the rest. I'm so tired.
9 p.m. seems so late.
It does, doesn't it?
This is music to my ears.
Meredith, I think in listening to you as well, this young man, his first name was Zach, and we had 7 boys in my home, 5 in my main home, 2 in my transitional home all the time. But I saw him try to work overtime, and he did. We found him a job with us. We painted houses. We get him out of his wheelchair, and I don't mean this in a derogatory way, but he could walk on his knuckles to pull weeds around the house, and he could pull himself. I mean, his upper strength from his wheelchair was unbelievable. But I saw him pushing himself, and that's why I asked about emotional, because again, you're talking, 7 young guys. He was the only one with a disability when it came to a physical disability at that point. He would get angry. He didn't, and we knew he wasn't lashing out at us, but we knew that he was angry. But listening to you talk more and more, it just makes so much more sense.
Yeah. My experience, my manifestation is probably not comparable, but I can just kind of put myself
Yeah.
in his situation and see how frustrating that would be. Absolutely. And the compensated strength is fascinating, because I'm so used to saying that I have low muscle tone over and over and over again, that I would like have weak core muscles. So
Yeah.
I went to a physical therapist maybe 2 years ago, and she said that my spine and my core was like too strong, probably because I've compensated for the fact that I had low muscle tone at one point. So then, like, I have trouble rounding my spine because it has become so strong. So it's
Wow.
just kind of interesting what, like, he had such strong arms that he could drag himself on the floor.
Yeah.
Um,
This
I
is
think
great
it's
stuff.
really, I think it's really eye-opening too when you say, like, it's tiring for you to sit. Like, I think of sitting down as a relaxing thing and getting comfortable, and like, I want to sit down, and so it's just very eye-opening and makes you think, like, if this is difficult for them, like, what other things might be difficult for them or for someone with
yeah,
CP. Sorry.
yeah, yeah. My legs hurt. I think I will say that working from home has been better in that. Like, I think being in like the conference room, sitting in a chair in a conference room, for example, is probably the worst, where my legs will ache and hurt and my back will hurt. Um, but I also feel like I have to kind of be sitting upright, because if I slouch, that makes it worse.
Right.
But sitting upright takes so much energy. Um, yeah. Whereas, like, if I'm lounging on the couch watching a show, it's not tiring, but it's not good for my body either after a long period of time. But it's a different kind of energy. So at home, it has been kind of easier because I can really break up the way I'm spending my day.
Mm-hmm.
Last thing I have is a little time for Q&A. Um, if we want to do that, and I can stop sharing my screen. I'm just so glad you could join me.
Meredith, I have a question. And you
Yeah.
kind of touched on it a little bit when you were talking about your conservation crew work, but something that, I don't know how to say this, something that I've experienced working with consumers with disabilities is that they really have a hard time knowing how or when to disclose to their employers that they have a specific condition. So I was wondering if you could talk a little bit more about your experience with that.
Yeah. Well, it's actually really relevant. Recently, I never said I had a disability until I was applying for this job, and I was writing a cover letter for a job working with individuals with disabilities, and I go online to fill out the application for the job, and you have to check off, do you have a disability? And for the first time, I thought, well, I should read what counts as a disability, because if I'm going to work with people who have them, I should probably know. So I read the whole blurb, and it's, if at any point in my life has there been something that has significantly impacted me, and listed in the list is cerebral palsy. And so I said, yes, I believe I absolutely do count as having a disability. And so before that time, I really didn't in the workplace disclose. And it's kind of sad, but I like, because it would become such a big thing. So I would not say anything, and I'd be working in the trail crew. And then we would be at this place where we'd have to cross the stream, and we'd be carrying rock bars and Picmatics and packs. And I wouldn't be able to do it on my own. So I would need someone to hold my hand, or I would need to use a stick to balance with, and I would slow the whole group down. And then there would inevitably be this like discussion where I would disclose that I had this disability. And I wonder, had I approached it differently, just talking to the crew leader in the beginning, saying, hey, this is something that might come up for me, then maybe wouldn't have been so stigmatized for me at that moment. But now that I've applied for this job, and in probably every area of my life, I disclose it right away. Like, I met a new friend to go hiking and I mentioned it. And I was also having extreme fatigue at the time, so it felt appropriate to mention. And the more that I share it with other people, I think it makes me feel more okay. And I realize that there are things that we could do to change it so I don't have to suffer. Like, and there are really small little things that we could do, like that someone could just know every time we cross a stream, I hold Meredith's hand. It's as simple as that. So that really didn't come into my life until I applied for this job. And in school, like, I know, I memorized like that I had an IEP and a 504, but I really don't remember. And maybe just because I block stuff out, but I don't remember a lot of intervention. I know there were moments when I would meet with someone separate. And I guess in elementary school, I think there were probably more, like, there were meetings and I had the physical occupational therapist. They would come to my house, they would work with me. But I do recall, like, in gym, when you have to climb the ropes, I have a memory in elementary school and my gym teacher just checking in with me because he knew that I needed a little extra help. And so he just very kindly kind of talked to me on the side and said, hey, are you, like, you can give this a try, but if it doesn't feel good, that's okay. Or, but pretty minimal, because I think, like Lauren talks about this, like, where students can be in an IEP and not really know why or what to do about it. And I think that sort of
Absolutely.
happened to me. Like, I knew I had, but I was ashamed by my cerebral palsy, or I didn't understand it very much. And I was a kid and it was all just sort of being done to me or for me. And I wasn't in this position of being in control of understanding what was going on with me.
Meredith, though, your strength, when it does come out and when you're talking about this, I'm just thinking of how that opens up for other people that you're talking to who may have an underlying disability as well, where they can say, wow, it's okay to talk like this and about this. You open a door more than I think than you probably even know.
I'm just so glad I had the opportunity to do the project at this time. It really came into my life at the right time, and then to be able to share back with you all. So
Stuff.
Nice, Meredith.
yeah.
Very nice. I think it's worth noting too that the people along the way, like the providers, like I'm thinking in particular, coming into the classroom and the whole class did the activity versus you being pulled out or pulled aside. Even though, like you say, it felt like a lot of it was done for you and you may not have had that understanding or the knowledge that you wanted as you got older. I think it's imperative when they're younger like that to keep it as normal as possible and not pull that out, because I think that's when you're really emotionally developing and you start pulling kids out in first, second, third grade. Oh, all hell breaks loose then, because that's their formative years and that's when kids are mean. And it's just really good. And your parents, I mean, wow.
Yeah.
That's up to them.
My parents, and it's true, when my mom told me that, she said, oh yeah, they would just come into the classroom, everyone would be excited. They'd be like, Bonnie's here. And they would all do this and it was integrated. And I was like, holy crap, Mom, like, that is really awesome that that's what I got, because not a lot of people get that.
Yep.
And I did in middle school. There was one time when this woman pulled me out of the classroom, and then she had this device and she measured the angle on my wrist when I write and told me that it was wrong. And then she, like, hung around with me at recess, and I was so upset and mortified that I told my parents, they told the school, and it never happened again. And that's probably part of why by the time I got to high school, I said, I just want the 504, like, let's just keep it minimal.
Yeah.
But yeah, that's like the one thing I remember, because it was awful.
Mm-hmm.
If you were to give like one suggestion for us working with people with CP, like what would that be?
Ooh. Ooh.
She's on fire today with her questions, man.
I
Is.
know. I love it. So one of the things that showed up so I had this like 2 or 3 hour phone conversation with this woman who's my friend's mom. And I went into the conversation thinking we would talk about like what it's like for her to peel potatoes or to walk 20 miles. Well, you don't do that, but like I wanted to get more of the functional aspect. And what we ended up talking about was like romantic relationships. And it came from like self-confidence, and how this woman, she went from she had struggles with bulimia in her youth. She married a gay man, and then they got divorced, and she never saw herself as someone who would be desirable to someone else. And Neil talks about like the person he knew comparing maybe to other people on the workplace. And I had my experience in Montana and with my boyfriend and holding myself to this crazy high standard, and him giving me language that was like, I had a lot of respect for you when you did that. And then I would feel like that was how I am respected. And so my piece of advice would be to really focus and to give space for the self-confidence growth and the motivational interviewing type of speaking, and recognizing that like the physical details are super important to work on, but that with something like this, when you are literally holding everything together in your body physically, that's also probably happening in the mind.
Thank you.
There you go. Just dropping that.
Good thing to drop right in the middle of the room, really.
I think it's been an hour, so I don't want to use too much more time. But if anyone has a last question, I can take one. Otherwise, thank you for listening to me. And I don't quite know what's going to happen when I stop the recording, if it will get sent to Neil or if it will come to me. But when I find it, I'll send it out to everyone else.
Thank you, Meredith.
Great,
This was
thank you so
awesome.
much.
Let me I'm
This was
going to
great.
stop it right